always say, pay attention, notice signs of infection, itching, irritation, burning, odor. And that odor is a little tricky. So some of us are a little sensitive to our natural odor.
Hey HBC family, it is so good to have you join us again. This is Dr. T hopping on here as HBC goes on the road. This time we are visiting the local community of Palmdale, California. As many of you know, I typically travel internationally, but this year I'm visiting some of our local communities. Palmdale is located just north of Los Angeles City, and in 1986 had about 23,000 in population. It has grown now to over 160,000. 44% white, 30% other, 12% black, and ethnically 61% Hispanic. I was happy to join the Wildflower Project as we celebrate Black Maternal Health Week. And instead of me doing an interview, I am now being interviewed by Councilwoman Juanette Collars.
Today we will be offering a mini sound bath for all of the participants here in the Black Maternal Health Expo put on by Wildflower Project here in the Antelope Valley.
So I'm going to guide you through a brief meditation. So if y'all could just, whatever you're doing, just put it down. It's all good. Close your eyes. Take a deep breath in through your nose, filling your belly and your chest, and exhale. Thank you. Your sound bath is complete.
How you're providing knowledge to your back in terms you're going down the list of concerns or questions that you have. So I always told my patients when they had questions of, for a doctor, I said, write it down. Seriously, write it down so you don't forget. Because a lot of times you're like, doctors are just like next patient to the next patient to the next patient. So they're just trying to get in and get out. So when you have a clear, concise question or concern, they usually can listen. Look them in their eyes and let them know that you are concerned, that you're not feeling well, that this is not your normal self. You do have to advocate for yourself, and I also will encourage you to bring someone else with your needs. I noticed that a lot of times doctors speak more to my patients when I was a bedside nurse, when I was standing right there next to them, so they would ask me a lot of times, I can't hear when the doctor comes, so I don't understand them, I want to explain it to me. But also when I was doing work with case management, and I would go into the room with those patients, the doctors would talk a lot longer. And unfortunately, with my health and with my children's health, I had to use my nursing card. Like, I'm a nurse, so I know what you're saying. Talk to me clearly. I have questions and concerns, but I would encourage you to bring a partner with you, some sort, a mother, a grandmother, a friend that is going to advocate for you, that's for you. You feel like you're not strong enough to speak up for yourself, and then have questions.
Thank you for being here, and we had such a great conversation.
Yes, we did.
We did. So I was so excited. Like Michelle was talking about writing down your questions, and I think there's always questions we have as women, and we sometimes just don't feel comfortable asking those questions. And I was giving her all these questions, and it felt so good that you wanted to talk about them. And I think that's one of the things about being comfortable having a Black doctor, where you feel that sisterhood and you feel like you can ask those things. So I want to go through some of those questions, and then I want to talk about, tell us what kind of, she touched on what kind of doctor you are, but primarily, who are the people you're seeing, what are you doing, what's your clientele, where's your office at, all of that stuff. Tell us a little bit about yourself.
Hi everyone, I am Dr. Taskamore, but you can call me Dr. T. I have been in OBGYN for almost 18 years. I've traveled around the world providing care. Oh, it's a little bit down. There we go, that's way better. I've traveled around the world providing care, education for women in impoverished countries. I have worked almost exclusively for my whole career in community medicine. I'm currently in East LA. I do have patients that come from Palmdale, so it's good to kind of see and be a part of that. Yes, I get to see where they're coming from and truly appreciate their travel.
So I have specialized training in pelvic floor also, and so I use that education to assist women in preparing for childbirth, which is a little bit atypical. I also am a health coach, so I utilize that information, that training, also to provide more specific guidance when it comes to living a healthy lifestyle.
What is you said a coach? What does
Yeah.
a coach do that's different than a doctor?
So, believe it or not, we get very minimal training in nutrition and exercise, and really how to utilize your nutrition and how to utilize your exercise as a part of your treatment course. So a health coach not only helps you and guides you to come up with a program that works for you, that's individualized for you, but also help you work through some of the barriers that lead to limitations when it comes to health and wellness. So I do what's called motivational interviewing, trying to get to assess where people are in their journey. So not everyone is ready. And so sometimes some of the time is spent getting people ready to make the lifestyle changes. And then for those who have been making lifestyle changes, we're able to use certain techniques to help when you hit a relapse. You know, how many have been on a health course and then something happens and it throws you off and it's hard to get back on track. So I help to identify what that happens and help them get back on track.
So, what is one of the first things to get back on track?
One of the first things to get back on track is to, one, recognize when you're off the track. And then be really honest with yourself as to what it is that is the limitation. So oftentimes when I speak with patients and I ask them the question, what do you think happened? Your insight is very, very critical and important, so never underestimate your own insight into your own health. Sometimes I get the response, oh, I'm just lazy. No one is just lazy, that is conditioning. The question is, what is it that you feel makes you feel lazy? Sometimes it's fatigue. You know, people oftentimes miscategorize laziness with just chronic fatigue. Sometimes we're just chronically tired. And as was mentioned earlier, that was a really interesting conversation about the impact of lack of sleep. Well, in this country, we don't prioritize sleep. So oftentimes when my patients come in and we're doing that initial assessment, we're going through, what is your stress level? That's really important for women of color because we know that chronic stress is one of the primary impact on our outcomes. But I also ask about sleep. How much are you sleeping? Are you sleeping continuously? Are you waking up? You know, they use sleep as torture. In other countries, when they have foreigners, they use waking up the individual every 2 to 3 hours as a form of torture. Well, guess what? That's what most new moms are doing. So that just shows you just how much sleep is critical and important to your health. And then understanding fluid intake, water, exercising. Well, our experience is a little bit unique, right? Exercise is not that easy. It's just, you just can't go and exercise because a lot of my patients live in neighborhoods, they can't go walking and feel safe, right? So sometimes it's addressing how safe do you feel to go outside and exercise, and if you don't feel safe, exercising and coming up with options where you could do indoors. And safety is not just for violence, that's usually sort of the assumption that we're only talking about violence, but also policing makes us not feel safe when we're in other neighborhoods.
So we've been talking about, this is maternal health, but we're talking about the seasons of health and about women's health and about vaginas. That's what we're talking about. And now there's all these things, you know, you can do this, eat this, it tastes like this. What are things we shouldn't be putting in there? Or how do we basically take care of our vaginas? More than just we want to have a baby. We want to do other things with it. And we want to work with it after we have a baby. We had some questions about that previously. But how should we be taking care of it? What's appropriate? What's not? We had a discussion about waxing, not waxing, things like that.
I love having vagina talk. So the one thing for us to know is that the vagina is an amazing organ. It is probably one of the most amazing organs of the body. She can stretch to the extension of being able to deliver a 10-pound child and then snap back immediately, right? She's able to provide sexual pleasure and at the same time protect the body from bacteria and other types of imbalances. So the one thing is, she is pretty much capable of doing what she needs to do on her own. There's very little we need to do besides paying attention to signs when things may be off. So for the most part, she's a self-cleaner. We do not need to add things and do things to help clean her. She's able to clean herself. She lives right next to the vein we call the rectum. So she lives with a multitude of bacteria. And that is normal. The vagina is not sterile. Like oftentimes we assume that the vagina is somehow this sterile organ, and she's not. But she's able to control her neighborhood very well. She excludes people who need to be excluded, and she includes people who need to be included. Right? So that's how the vagina works. Once you start adding things, and she's also very sensitive. Right? So sometimes using different types of products result in a chemical irritation as a result of those products. Then you start to change your pH. And oftentimes it's a misnomer when we say you have a vaginitis if you have a vaginal infection. It's a little bit misleading in the sense that you think you acquired some bacteria or some organism that's not normally there. Doesn't that sound like that? You have a vaginal infection, meaning something happened that came into the vagina and caused an infection. That's not really true. When we deal with things like bacterial vaginosis and yeast infection, the two most common causes of a vaginitis, they're normally there. Gardnerella vaginalis and Candida are normally in the vagina. It just, what happens is when your pH comes off and is changed or it becomes more basic, the vagina is a little bit more acidic. That's how she protects against different organisms. That's what causes the overgrowth of bacteria and different organisms that are normally there. So it's not an invasion that happens, it's just an overgrowth and an imbalance. So I would definitely say pay attention, notice signs of infection, itching, irritation, burning, odor. And that odor is a little tricky. So some of us are a little sensitive to our natural odor. The vagina has a natural scent. And I hate the word odor because it automatically sounds negative, but the vagina has a natural scent to it. And it's not gonna smell like the perfume that's manufactured, right? They spend many years creating those scents. Our body scents are different. If you go to other countries, you're like, ooh, it's a little strong over here. And that's just our natural scent. Our culture tells us that our natural scent is wrong or is bad. And so we buy all these perfumes and lotions to try to smell differently because of our culture. There's nothing wrong with how your armpit smells. That actually it's a function to it. And to the point of same thing with our cosmetic treatment of the vaginal area, waxing and lasering. There's an actual function to the hair that's on the pubic area. And so when you have that kind of rubbing between your legs or rubbing and friction sensation, it's because you lost that function of the pubic hair. It also protects against bacteria. It also helps to kind of normalize the environment, to control the environment. So there's a function to the hair that's on the pubic area. Now, certainly if it is your preference that you want to wax or you want to shave or whatever your preference is, that's fine, but just know that you're increasing your risk for us having infections, for having bumps, for having things that aren't normally there because you decided to make that change. Now, in your decision making, if you decide, hey, a bump every now and then, not a big deal, I like the way it looks, at least you're informed, right? But it's important to know that God kind of knew what he was doing when he put hair there. It was by accident. It's with intention and it's certain with function.
So, you kind of touched on this. So let me ask you a question. Because people say, like, if I eat pineapples, you know.
Oh yeah. I'm just saying the pineapple industry, they have got to love us, right? Well, it's you would want to hope that whatever you consume will somehow translate to the vaginal area, but guess what? It goes through the GI tract, and molecules change, they get absorbed. They don't necessarily produce what you're expected to produce vaginally. So there's been no studies that have confirmed that eating a pineapple makes the vaginal secretions taste any different. But hey, It doesn't hurt to eat some pineapples, go right ahead. Though I know the nutritionists are gonna say pineapples aren't even real. That's a whole other conversation.
So let me ask you a question.
Hybrid foods, for those who are like, what are you talking about? So certain foods are kind of hybrid foods, they're creative foods. Pineapples on that list.
How does, what's the association with African American women and fibroids? Like, why do we have such a high increase of having fibroids than other races of women?
That is the question of literally my entire career. Why? I've also had fibroids. I speak from a personal perspective also. We don't really know. We don't know the underlying cause and why. Research. There's just not enough research done on women of color, on Black women, to be able to answer these questions. I don't think they're hard scientific questions at all. But we do know that it's a huge factor for Black women. When you talk about, and it's more than just having the fibroid and dealing with it, there's also, from a medical perspective, there's also impact on our quality of life, right? So if you're bleeding consistently, you're having chronic pelvic pain as a result of fibroids, you're more likely to have missed school. You're more likely to miss work. You're more likely to not be able to socialize as much. How many people do we know who are like, oh, it's that time of the month, I'm gonna be bed bound, house bound? You know, that there are significant impacts as a result of these conditions, and Black women are disproportionately affected by fibroids, unfortunately.
How can you, like, know that you have fibroids besides having, like, irregular period or cramping? Is that the only signs, or would this show up on a regular pap smear? How often should you get a pap smear? Is it 1 year, 2 years?
I know that pastor question, we can change it every couple of years. I'm like, what is it now? I mean, it's an ongoing science, and that's just how to show you just how much science evolves. The one thing I would definitely say is go in for your annual visits with your OBGYN, and definitely find someone that you feel comfortable with. Because for some women, fibroids are asymptomatic. They don't have the heavy periods. They don't have the pelvic pain, whether it's pain with intercourse, pain with their cycles, or just daily pain. Some people may detect fibroids because they feel like their abdomen is getting a little bigger, but they know they're not putting on weight. That could be an indication of fibroids also. When they get really large, and you have fibroids that are on the outside of the uterus, they can compress neighboring organs. So in the pelvis, you have your rectum, you have your bladder. If the fibroids are large enough, you may start to see urinary symptoms. It's not always a UTI. It can be dysfunction of the bladder, but it can also be fibroids compressing the bladder. If you have problems having bowel movement, there are so many things that lead into those function. Fibroids is on that list as well. So sometimes when patients come in and we're doing their first trimester ultrasounds, they're sometimes surprised when we say, hey, you know, there's a fibroid there. What? I've never had any symptoms before. That's why it's so important to really keep up with your care, even if you don't have complaints. Even if there's nothing wrong, just going in to check, because sometimes we only detect it when we're doing that wonderful bimanual exam that we all hate. That's sometimes the only way we can tell that the uterus is a little bit bulky or a little bit enlarged, or we may feel some firmness to the uterus, and that may be an indication that there's a fibroid there.
I have another question. So, what is a normal menstrual cycle? I know some people say 3 days, 5 days. Is there something that you should be alarmed if that's you're not so fit in that?
Yeah, so there's two aspects. That's a great question, because that's really the origin of how we identify a lot of disorders, is I know what's even normal to begin with. So menstrual cycle in terms of frequency, anywhere between 21 to 35 days. And you're starting your count outside of the apps, let's pretend apps don't exist. You're starting a count on day number 1 of your bleed to day number 1 of the next bleed. And that's how you know the length of your cycle. The duration of the cycle can be up to 8 days, some 8 days, and still be within normal. Some women may have a lighter cycle, especially as we go through different phases of womanhood. Our cycle changes as the needs of our body and as our hormone levels change. Once you get to that perimenopausal time period, What's really important to know for our 45-year-olds and above is once your cycle starts to become heavier, if you're sewing pads, you're becoming anemic, those are indications that you need to be evaluated. Now, a lot of patients are going to have those symptoms as a result of just the hormonal fluctuations at the end of our reproductive years. But sometimes it can be an indication of endometrial cancer and other things that are more serious. So anyone who has a normal bleeding between cycles is also alarming. You should not have, even if it's a light spotting. Sometimes you're on birth control, you can have that intermittent bleeding. Still check with your physician to make sure it is the birth control that you're on and not something else that's causing that abnormal bleeding. And I didn't answer the pap smear question. Let me get back to that before I forget. So in terms of pap smears, there are, in medicine we don't always agree. And there are different organizations that are sort of the professional organizations that look at lots of studies and decide how are we going to manage this particular disorder. And sometimes we don't agree. And so sometimes we have different guidelines. And so there is a new guideline that says we can start at age 25 to start your initial screening for your pap smear. The American College of OBGYN still advocates for starting at age 21. The duration of your pap smear depends on your age group. So for our youngest women who have higher rates of human papillomavirus, which is a sexually transmitted infection that doesn't have any other symptom outside of a normal pap smear, when we're talking about that higher risk HPVs, which are the ones that we're interested in that are causing cervical cancer. The other thing to know is that, so in our younger women, we do our pap smear every 3 years because we know it's very likely that we're going to catch HPV in that age group, but they're also healthy and they're much better at clearing the HPV virus. And so we don't screen for HPV in the youngest age group. But in older women, we know HPV is more likely to be a chronic infection. And because of that, older women are more likely to have higher risk of having conversion of their cells by these oncogenes that are causing their cancer cells. And so for those women, we're doing either HPV screening now, so now you can only have HPV screening, which is the same process as a pap smear. It sounds like we're doing some other testing. It's the same process as a pap smear. And that can, if it's negative, you can go back every 5 years for your rescreening. If it's positive, you may have to go on to have a procedure called colposcopy, which sounds scary, but it's really us using what looks like a big microscope to take a very more in-depth look at the cervix. Now, what is a pap smear? Let's start here, because this is always the point of confusion. Having a pelvic exam is not equated to a pap smear. So oftentimes, women will come to me from outside facilities and say, oh, I had a pap smear last year, and we're trying to get the records, and there's no pap smear. But what they're equating as a pap smear is a pelvic exam. So you can have a pelvic exam that evaluates the outside skin of the vagina, the cervix itself, that's us visibly looking, and then palpating the uterus and palpating the adnexum where you have your tubes and your ovaries. That is not a pap smear. A pap smear is part of a pelvic exam where we take a side of brush or a spatula, there are different techniques, and different clinicians have different preferences, and just swirling that inside the opening of the cervix to collect some cells. That is your pap smear. So you can have an exam that's only just to collect the cells to get your pap smear done, but oftentimes most of us are getting complete pelvic exams, which may or may not include a pap smear. So once you have your exam, just verify with your clinician, did that include a pap smear today?
Does a pap smear show like cervical cancer?
Yes, exactly. So the whole reason why we're doing pap smears is because otherwise there is no symptom for cervical cancer until it's advanced, until someone has pelvic pain or bleeding. And we don't want people to get to that point because we want to prevent cervical cancer from happening. And so the purpose of a pap smear is to identify those who are at risk for developing cervical cancer. Along the same lines, in terms of prevention, we should also talk about HPV vaccine. So the HPV vaccine, which is internationally provided, it's not just in the US, the data is really strong. A recent study came out, at the end of last year, that has shown that we're effectively decreasing our risk of cervical cancer as a result of the vaccine. So it's very effective. our cutoff, the absolute cutoff is age 26, but it increased for consideration in women up until age 45. So if you're kind of like, I was told that I couldn't get the vaccine anymore, you still have a window, you can have that discussion if you're under the age of 45 years old or under.
I didn't know that they did that. I remember when my daughters were young, I'm always like, I don't want any shots unless I have to. And so I have a doctor, I would get it for your girls. And one of my daughters called me from college. She's like, "Oh, I'm so glad you got that for me." I was like, "Why? Like, what are you doing up there?" She's like, "No, it's just some kids were getting it in college and they had not had the vaccination for it." So
Yes, and we talk a lot about cervical cancer, but HPV is also linked to vaginal cancer, vulvar cancer, throat cancer as well. So especially if you enjoy oral sex, I know Michael Douglas has talked about his HPV-related throat cancer. It does happen. So the vaccine helps to protect you also against the low-risk HPV, which causes genital warts. So high risk causes cancer, low risk causes warts. It's like one big family, all different members of the family. The vaccine is very helpful in preventing a multitude of diseases, not just cervical cancer.
I did hear about the throat one, but I kind of thought it was a joke. I didn't know it was like for real.
It is actually for real. Yeah.
Did you guys know that? So, what is a normal age to start your menstrual? I was teaching and I was in the nurse's office and she said, "I have first graders." And I was like, "What?" I was shocked. You know, like when I came up, you know, you're a teen basically. Some girls were like maybe 10, but.
And that's correct. However, the one race that has been documented to have earlier onset of the menstrual cycle are Black women.
Really? Now, why
So
do you
Black
think
women
of that?
are, I think it's a multitude of things. This is Dr. T. This is not scientifically proven. But if you guys fund me, I will prove it for you. So I do think that the experience, as we all know, the experience of Black women in the U.S. is very unique. It correlates into just about many aspects of our health, right? It correlates to the maternal mortality issue that we've been talking about, but it's the same impact. If you live daily under chronic stress, which is really what we're talking about, the life of a Black woman in the U.S. is chronic stress. Our bodies are not intended to endure stress on a daily basis. The body's intended to respond to acute stress and then restabilize after that acute stress is gone. So when you're living on a chronic stress every day, it's going to change everything. It even changes the structure of your brain, right? So we know neurologically that the brain is also changed by the impact of stress in addition to your thoughts, and negative thoughts changes the structure of your brain. So there are a multitude of things that I think exposes us to that. We live in communities where we don't have equal access to healthy food options, and what you eat has a tremendous impact on your health. So I think for us, it's a multitude of issues, but I think the baseline and the foundation of it is living under racism on a daily basis, on whether it's affecting the jobs that we get, our experiences at work, our availability of having childcare. I mean, there's a multitude of things that get impacted in our lives when it comes to the impact of racism on our lives, and that translates into our health, unfortunately.
So, if you were to tell a woman, like, as soon as she starts her menstrual, like, what would be the tips for you to, like, have a happy life, nice pregnancies, no problem, like what would be, like, the tip? Like, I was thinking, if someone told me, like, to eat this way when I was younger, I would be much healthier. But just, like, to totally take care of yourself, like, because I hear a lot of women I know, like, my age, they've gone to school, and a doctor, and all these things, and now it's like, they're in their 50s, and they want to have a baby, it's too late. You know, like, when is it too late to have a baby? When should, you know, should you freeze your eggs now? I mean, that's the thing people are doing. Like, what would be the advice that you would give for young women wanting to have a baby, not ready yet, haven't found a person, you know?
I love that question, because I wish that we could talk about this more. I wish somebody had this discussion with me, right? So one of the things that I would advocate for is healthy living, as we've been talking about. So the healthier you are, the more likely your outcome when it comes to pregnancy, when it comes to your fertility health in general. But also having a real conversation with yourself is what's important. Not your mama, what your mama expects you to do. Not your daddy, what your daddy expects you to do. Not your girlfriends and what they did. But what you truly want. And not everyone wants babies now. We actually just did, so I'm also founding Healthy Mom Club. It's a digital program where we talk about these topics by women of color healthcare professionals. And we really just taped yesterday discussion on the older age moms and the shade that moms are getting for making the decision that they want to have kids older. So here's the thing, we know scientifically that having babies older, as of now, where our population is today, has a higher risk, right? We know that age increases, not just paternal age also. We also forget to tell the dads that an older dad also has more complicated pregnancies as well. But for moms, we know that over the age of 35, that there's 35 years and older, there's an increased risk of miscarriages, there's an increased risk of abnormal pregnancies, like Down syndrome and other types of syndromes. There's an increased risk of maternal medical issues like gestational diabetes and hypertensive disorders. We were talking about preeclampsia earlier. And on that topic, if you want to add to that discussion that we had earlier, the recommendation for low-dose aspirin includes patients who have high-risk issues. So if you have lupus, if you have chronic hypertension to begin with, that is considered to be a high-risk factor for preeclampsia. Then we have moderate risk factors. Black women are the only race that's on that list as a moderate risk for preeclampsia. Also, if your height to weight ratio, or your body mass index is elevated, you're considered to be a moderate risk factor. If you live in certain socioeconomic communities, that can also be a risk factor. So for most of us, we'll end up on low-dose aspirin. It should be on low-dose aspirin and not waiting until the pregnancy has, or at least offer it, I should say. And I shouldn't say be on it, but offer it. Because with everything, you should be given the information so you can make the decision as to whether or not it's the best option for you. There are some patients who may not be able to tolerate low-dose aspirin because they had bariatric surgery, for example. So it's a conversation to have. The reduction rate that we're talking about is 24%. So this is international science, it's not just American science. Internationally, they do a little bit of a higher dose than what we do in the US. So that being said, certainly having these chronic issues and also birthing is a little bit more, you encounter more difficulties. There's a higher C-section rate with older moms. So here's the thing, having that information is up to you to make the decision whether or not you're willing to accept those risks. And if you are saying, yes, I do want to have a baby later because I want to pursue my career, or I may not, one of the girls on the platform yesterday, she was talking about just not even feeling like she's emotionally ready to be a mom. And she made the decision to wait until she wanted at some point to be a mom earlier, but it just doesn't work out in terms of partners, and that's a whole other conversation when it comes to women of color finding their right partner. But ultimately, she decided, which I thought was really a great point, to change her lifestyle. And so she exercised regularly, recommendations of 150 minutes per week. Most of us are not doing that. The other thing is she started to eat healthier. She started to self-care, so I love that self-care trend. Dealing with stress, de-stressing is hugely important. My patients, we always talk about activities and ways to de-stress as part of their medical plan. So it's not all medications. We do a lot of things non-medical that are equally helpful. We know also that exercise not just impacts the outline, but a lot of people don't know exercise impacts the life of the baby. The baby ends up with a healthier weight. If you have a healthier weight, you're more likely to have a successful vaginal delivery. And also babies who are born to moms who exercise are more likely to have a healthier heart. They're less likely to have childhood obesity. We know childhood obesity leads to adulthood obesity. So if you want to break those generational, I hate the word curses, the generational issues in our families, that's one way of setting your child off in life on a good path is really helpful. And there are some studies that also indicate that babies born to moms who exercise tolerate labor better. So you ever heard the indication of fetal distress as an indication for C-section? If you want to minimize the chances of having fetal distress as an indication for your C-section, exercise. So utilizing the information we have to make sure that we have better outcomes with our pregnancy. And then they say also that some studies show that babies are calmer. So you want to calm our baby? Exercise.
So what exercises can you do being pregnant?
Almost everything. Oh, yes, I love that. Listen, I'm not a yoga teacher, but I include yoga positions at the end of pregnancy as we get the body ready for childbirth. So thank you for saying that. But a lot, there's actually very little restriction when it comes to exercise. Certainly you can't do touch football. You can't jump out of a plane. You can't scuba dive. So anything with high altitude or altitude changes, anything that causes you to fall, you won't be able to do. But I had a patient who was weightlifting in the park, and other people were coming up to her asking her how should they exercise. That's what I'm talking about. I was like, girl, you gotta do it, okay? So there's a lot you can do. Certainly, if you didn't weightlift before pregnancy, this is not the time to start that regimen. Certainly not on your own without guidance. But if you have been lifting weights and you have been someone who goes to the gym and you do a more aggressive workout, you can continue that workout. The key is, are you getting winded? So if you are unable, we do what's called a talk test. So this is the health coach part of it. We do what's called a talk test. So can you talk while you're exercising? Some people are so well conditioned that they can do high impact exercise and still talk like it's nothing. And for some of us, we get winded walking the block, right? So you gauge as to what's appropriate and what's good for you. So most of my patients will start with walking. It also making sure that it's not too low impact. So if you're able to sing while you're exercising, that's not a high enough impact in pregnancy. So the recommendation is 150 minutes per week, and you can break that up however you want. Some of my women will do 2 days, an hour, and then 1 day, half an hour. Another one will do 30 minutes, 5 days a week. And then someone will break up 30 minutes and do 10, 10, 10 because their lives are really busy. And they feel like they don't have a 30-minute section. If you do 10, 10, 10, the outcomes in this research show the impact on your health is no different than doing 30-minute sets.
You are just a wealth of information, isn't she? I mean, I'm like, every question, she's like, I love it. I mean, because I can come up with questions all the time, but I think these are really helpful for ladies. And I think, like someone mentioned before, when you go to the doctor, they give you such a short time, so you're not able to ask these questions. I always leave like, I had another question. And like Michelle said, it's good to list all of these things down and ask these things. We were talking, someone and I were talking about educating children. Like, when is the age that you should be educating a young lady about being a woman and how to take care of herself and, about her menstrual life? When would you suggest?
So I love seeing the preteens, and you can actually bring your preteen to the GYN. So you don't have to wait for her to become sexually active. That's oftentimes too late for us to really shape their impression of yourself and their self-worth. You don't want other people to define that for them when they become sexually active. You want them to have a good sense of their self-worth and their bodies before they become sexually active. So I like to see preteens. I love when preteens come in my office, and also because we catch hormonal imbalances in our young girls, right? So how many of us heard of polycystic ovarian syndrome? If you haven't heard of it, as a woman of color, you should hear about PCOS, because a lot of our girls are affected by PCOS. And the only way I catch that usually is when the pediatrician sends the preteen to me. I wish that the moms and the dads would identify the irregularities and send their kids to me. So I would say the earlier the better from a medical perspective, but I know we all have different traditions, different belief systems. I'm just sharing with you what would help from a medical perspective, the earlier the better.
So how do we follow you, listen to your podcast, tell us where your practice is, how do we stay in touch?
So I'm at the Community Clinic for White Memorial Medical Center. So I'm in Royal Heights. And then in terms of my foundation, Healthy Belt Club, and it's a group of women of color, we talk about everything.
And we're going to share everyone's contact information and where you can find everyone that was speaking today on the Wildflower Project social media pages. And everyone is supposed to like that page to win prizes today as well. But we'll have all the information to be able to get it out so everybody can stay in touch. If we have any questions, come on down.
I also have cards today, so if you want a card, I can get one for you.
Hi. My question is regarding pap smears. They used to be every year.
You have always. Oh, what? Oh.
Go ahead for her. It's okay. Worry, ma'am. So you can either start at 21, 25. You can have a discussion with your clinician as to what's most appropriate for you. For our older women, we do every 5 years if your pap smear is normal. If your pap smear is abnormal, it may require more frequent visits as you're under a higher surveillance for cervical cancer. Once you hit the age of 65, you can decide whether or not you want to continue. If you haven't had a history of abnormal pap smear issues or cervical cancer, you should be able to stop. If you had a hysterectomy that removed your cervix, that's important to know. When they take things out of your body, know what they took out of your body. I still see patients who have no idea what was taken out of their body. These are organs. So make sure that you ask if you have a hysterectomy, was my cervix removed? Because if your cervix was not removed, you need to continue having pap smears.
So if you had a total hysterectomy, you don't need to worry about.
For non-cancerous reasons, yes, you don't need to worry about pap smears.
Well, I was thinking as I get older, I'm more at risk for cancer because I hear about older people, they start bleeding and then they've got uterine cancer, stage 4.
I'm so glad you said that. So cervical cancer and uterine cancer are different in what causes them and how they are diagnosed. So we do not have a screening test for uterine cancer. That's important to know. How we often detect uterine cancer is the part where we were talking about our perimenopausal women, especially who start to have dysfunctional bleeding, and they're trying to decide, is this because of the perimenopausal or is this because something serious is going on? If you are diabetic, definitely get it checked out. If you're over the age of 45 and you have a normal bleeding, I say anyone with a normal bleeding, get it checked out, especially these particular women are diabetics. Our patients who have highest body mass index, so if your BMI is over 30, get to know what your BMI is, because that is going to be one of your indicators as to your health. I know I have my curvy women who are fit. Those are the exceptions. For most of us, we're not doing the things that we need to do to help our health, and so that BMI really helps us to track our health. So if you have a higher BMI, you're diabetic, you have a family history of cancer, you should definitely get every type of normal bleeding evaluated. And that may include just an ultrasound or include a biopsy of the uterus. And that's how we diagnose and identify uterine cancer. There's also no screening test for ovarian cancer. This is why it's so important to get your annual exams done to make sure that things that you may not necessarily have symptoms of, you may be able to detect on exam. Cervical cancer, however, we do have a screening test, and that is the pap smear.
But they don't do the annual exam.
You can go in for an annual exam. Yes. Yes.
This person was 3 years and this 5 years. I'm like, well, I'll just pay for that.
So an annual exam doesn't necessarily equate to a pap smear. So you can go in for an annual exam where you're supposed to be getting your diabetes screening, your cholesterol screening, making sure your eyes are good and everything like that. And then you can also have a pelvic exam, especially if you're identifying symptoms. If you don't have pelvic symptoms, you may not necessarily need an exam. That's up to your clinician to decide. But an annual visit, everyone should be getting an annual visit. Every single adult should be getting an annual visit. But it doesn't always equate to a pap smear. You can go and just bring a pap smear.
You have a man doctor?
If you've had the HPV screening and you've had a negative screening, you only need it in 5 years.
I was kind of shocked when they said that. I was like, well.
Oh, that's a great question. So how did we come up with the 5 years? I'm glad you said that. We came up with the 5 years because cervical cancer is a slow-growing cancer. So when they looked at the data, the likelihood, there's certainly going to be exceptions, right? Because when we look at science, we're looking at population count, right? So certainly you can have a discussion with your doctor if you're like, I just want to have it. The caveat to that is insurance companies. Because insurance companies, as much as you say, this is what I want, you guys may come up with that decision, the insurance may not cover it. And there are some patients who will say, okay, fine, I'll pay out of pocket. I just want to get it done, right? So as long as the key is, as long as you have the information to make the right decision for you, that's what's really key and important. And also knowing that insurance may not cover it. You're most welcome. And also for our mature women as well, when it comes to going into that phase of life, the third phase of life, if you have, don't ignore the function of your bladder and your bowel. I'll say that. Because oftentimes the function of your bowel and your bladder, even though we don't always pick reproductive organs, they can be as a result of something going on with your reproductive organs. So the pelvis is a small community of organs that live together that share the same innervation. So sometimes something that's happening in one organ can be manifesting as a symptom in the other. So don't ignore, if you're having difficulties having bowel movements, that should be evaluated. If you're having difficulty urinating, or you're going too frequently, or you're having an oops every now and then, and that oops bothers you, definitely go in to be evaluated.
I was going to ask you, you were saying something about bladder. I noticed all these poise commercial and all this bladder control. Is this like bladders, or is this like a high rise now, or has this been always? Or
this has been always, but we don't talk about it because a lot of times women feel so embarrassed by our vagina. Like vagina health really is a stigma for women. We're trying to destigmatize that because it's really just another organ like any other organ in the body, right? So why do we feel so ashamed when it comes to our vaginas? So I'm glad that we're having this discussion. So sometimes as we get older, we know the same estrogen that helps you have a menstrual cycle is the same estrogen that's really key for the support of the structures of the pelvis. And so as women go into that third phase of life, when we become menopausal, and you have that decline in your estrogen levels, you may have symptoms like urinary incontinence issues. And it's not just our mature women, it's also even women who are younger. It's just more common or more likely as we have decline in our estrogen levels. But certainly if you've had pregnancies, babies, you have a job where you're lifting things all the time that are very heavy and you're not using the technique, you can have a decline in the support system of your pelvis, and that leads to the leakage. That leads to the problems with defecation. And oftentimes I talk about healthy living, but I forgot to include the pelvic muscles. We don't exercise the pelvic muscles. No one ever tells us to, right? They kind of, yes, exercise right now. Oh, good for you. Let's do our things together. We should be doing exercise. I'm so glad you said that. We should be keeping it together. Let's all keep it together right now, everyone.
yeah, let's keep it together. Let's keep it tight and right.
Exactly. I love it. We talk about we exercise our biceps and we get that six pack and we get that, those quads and those glutes. But we forget about our pelvic muscles, which are so key to the function of our organs in our pelvis. So don't forget to exercise and strengthen those muscles so that they can help support your pelvic floor. And on the flip side, we have some women who have had physical trauma, emotional trauma, that leads to a dysfunction in the way the pelvic muscles work. And so those women will have the opposite issue. They will have difficulty urinating because they don't know how to relax the pelvic muscles. They will have difficulty having pleasurable sex because they clamp up when there's penetration. And so they don't know that could be a sign of dysfunction. Oftentimes, I screen women for abuse who are in that group because there's such a strong correlation. Women who sit on the toilet for hours and they can't have that bowel movement, and they think it's just because the stool is hard. It's sometimes just because you don't know how to relax your pelvic floor. And so you use your respiration to relax your pelvic floor as you exhale. Your pelvic floor should drop. So next time you guys go to the bathroom and you're urinating, think about what you're doing. See what's happening in your body. How's your body functioning? When you're urinating, do you feel a drop in the pelvic floor? Do you feel that descent? Because if you're feeling that descent, that's good. If you don't feel like something dropped or descended to a certain degree, that means you may not be effectively relaxing those muscles.
Well, isn't she a wealth of information? I mean, for real. She doesn't know I'm going to have her on speed dial.
You can, absolutely.
I just really want to thank you for coming. I knew it was going to be great conversation from our conversation the other day. I'm going to definitely look at your podcast and look at your website. I want to talk to you more about continuing to educate the community here above the 14. But I want to thank you for coming out. And let's give her a hand, everyone. So up next, this is the time where we're going to be celebrating our mothers that are having babies. So we have 3 moms. This is what we call our pregnancy pageant.